Synergism. Okay. This is page 16. What type of symbiosis if you had E. coli in your blood?
Mutualism.
Mutualism.
Oh, okay.
Oh, no.
I feel you.
Is E. coli in your blood a good thing or a bad thing? So what type of symbiosis would that be?
Antagonism. No.
Or,
Parasitism.
oh, got you.
You sure you want the review today?
No.
What type of symbiosis would it be in terms of mold producing penicillin that kills bacteria? Antagonism. What type of symbiosis is it when E. coli produces vitamin K and that helps you?
Antagonism. Oh, no.
Mutualism. What is it called when a person is infected without signs and symptoms? What type of infection? Not latent.
Subclinical.
Subclinical infection. Infection with signs and symptoms?
Clinical infection.
Clinical infection. What is the etiology of the majority of gastric ulcers? H. pylori. Helicobacter pylori, which is Helicobacter. People with what blood type have the highest incidence of ulcers? O. Highest incidence of ulcers.
And that's negative and positive, right?
Right. It's just the O. It doesn't. The RH factor doesn't matter on there.
Okay.
What type of cancer may be associated with Helicobacter? Stomach cancer. Why would most cases of cervical cancer be classified as an infectious disease and not non-infectious?
HPV? Not microbe.
Because the cause is a microbe, which is HPV. Why would diabetes be classified as a non-infectious disease?
Because it's not caused by a
Because
microbe.
it's not caused by a microbe. Are most opportunists pathogens or non-pathogens? Most are non-pathogens. And what disease does pneumocystis carinii cause? Pneumonia. What would be the predisposing factor to get pneumonia from pneumocystis carinii? AIDS, which is immune suppression. So immune deficiency is the predisposing factor. What word describes the manner in which a disease occurs? Word. Top of page 16. Pathogenesis.
You had us cross that out.
No,
No.
not pathogenesis. You had us
I
Yes,
cross
it
out
did.
pathogenic and virulence.
Okay, so, pathogen manner.
How does Crinibacterium in your ears harm or help?
Nope.
Neither. So the relationship is what?
Mutualism.
Commensal. Because it doesn't hurt, nor does it help. What does it live off in your ears? Earwax. Doctor doesn't change gloves and transmits infection from one patient to another. What type of carrier is the doctor? Page 17. Passive carrier. Right. Do incubation carriers have signs and symptoms?
No.
Have incubation carriers had disease?
No. No.
They have not. They're infected
They're
without
infected.
disease. Do convalescent carriers have signs and symptoms? No. Have convalescent carriers had disease?
Yes.
Yes. Would person having a fever, would that be a sign or a symptom? It's a sign. It's a sign.
Because science can't be
Can be measured.
Can be measured.
Person has pain in their jaw. Would that be a sign or a symptom?
Symptom.
That would be a symptom. So what's the difference? How does a symptom differ from a sign?
A sign can be measured.
Sign can be measured or
A
observed.
symptom is something.
Symptom is felt. So what's a syndrome that is based on symptoms only?
Chronic fatigue
Chronic
syndrome.
fatigue. It's gotta be a syndrome. Chronic fatigue syndrome. What's the etiology of chronic fatigue syndrome?
It's unknown.
Unknown
They thought it
etiology.
was Epstein.
What's an example, 2 examples, 3 examples of infectious syndromes?
TSS, AIDS.
SIDS.
Toxic shock syndrome, AIDS,
Congenital rubella.
somebody said SIDS. If congenital rubella syndrome, I asked for only 3, that was 4, but there's one more.
Floppy baby.
Floppy baby syndrome,
That's the same as
pontopulmonary syndrome,
What is?
pontopulmonary syndrome. That's covered later on.
Oh, I'm about to say, I have that.
What's a syndrome that is classified as non-infectious? Down syndrome. By classifying Down syndrome as non-infectious syndrome, does that definition refer to the fact that you can't transmit it?
No.
No. What is calling it non-infectious?
It's
What
not
is that?
caused by microbes.
It's not caused by a microbe. Not caused by a microbe. If SIDS or floppy baby syndrome is classified as infectious, what is the underlying etiology?
Honey? Clostridium.
Clostridium botulinum. And what food should not be fed to babies?
Honey.
And what's the age cutoff that
Up to
sees?
1 year.
1 year. And babies under the age of 1. Well, technically, you should be lower than that, but under the age of 1. What does the toxin do that Clostridium botulinum produces?
Prevents
Not
muscle
paralysis.
contraction.
Prevents muscle contraction. Prevents, which is why the floppy baby syndrome. So most people who die of botulism, and let's say we're talking about infants now, die of what?
Suffocation.
Infant botulism.
Infant.
Respiratory
infant.
failure.
Oh.
Can't breathe because the diaphragm won't contract. All right. Then it's referred to as sudden infant death syndrome. What does Botox consist of specifically?
Pure
Active
toxin.
cosmetic.
Pure,
Active.
active,
Toxin.
dilute toxin. Does Botox consist of bacteria?
Yes.
No.
No.
It is pure, active, dilute toxin. It is not bacteria. It is poison. Is Botox? Why does Botox have to be active?
'Cause you.
So it can paralyze the muscles.
Right, because you need the muscles to stop contracting. If it was inactive, it's not going to do anything to the muscles. What are 3 uses? And there's more than 3. 3 uses for Botox.
Cosmetic.
Cosmetic.
Sweat, armpits,
Excessive
and-
Headache.
Excessive
Migraines.
perspiration,
Migraines.
and migraines. What is it about Clostridium botulinum that allows it to survive in honey? It has endospores. What is it about adults that they can consume honey and not worry about?
They have E. coli.
We have E. coli that produces bacteriocins, and that protects adults. Infants don't have a high enough level of E. coli. Why is AIDS not classified as a contagious disease?
You need direct contact.
Because it's a virus, it's not.
Because it's not spread through the air.
Oh.
It's not spread by droplet or airborne transmission. So what's an example of a contagious disease? TB. What's an example of a non-communicable disease? Tetanus. Example of communicable.
Look,
HIV/AIDS. Example of sporadic.
occurs only occasionally.
Example.
Oh, tetanus,
Diphtheria.
Tetanus and diphtheria.
Typhoid.
What has made tetanus and diphtheria sporadic in America?
Vaccines.
hygiene and sanitation.
Only vaccination. Vaccination made it sporadic. What's a disease? 2 diseases that are currently epidemic in America.
AIDS,
Whooping
pertussis,
Listeria.
Well, there's been epidemic in America as a whole.
Oh.
AIDS,
America as a whole. AIDS,
Oh, and that,
Whooping cough.
And then there's been whooping cough, AIDS in America. Whooping cough is epidemic in California.
Syphilis and Genesee
Syphilis in
County.
Genesee County. Now the syphilis I have to still look up on the
But you
website.
said
That may have been
two from the United States.
that may have been changed, but it was epidemic. I said 2, but I was thinking don't worry about it. What are 2 diseases that are pandemic currently? AIDS and TB. What are 2 diseases that have been pandemic in the past that are no longer pandemic?
Chickenpox, swine flu.
Smallpox, swine flu,
Plague and-
plague,
Plague and influenza.
influenza. What does the CDC consider to be the best way to prevent influenza pandemics or epidemics?
Vaccination.
Vaccination. If, let's say, if a person goes to the doctor and gets diagnosed with a disease, that person is referred to as a case. How many cases are necessary for an outbreak? 2 or more cases from same source or multiple sources?
Same thing.
The same source is an outbreak. What describes that the actual number of people with disease is 10 to 100 times greater than
Iceberg
Iceberg effect.
iceberg effect? If 50 people contracted tuberculosis today, would that be an incidence or a prevalence number?
Incident.
That'd be incidence. So if 50 people contracted tuberculosis today in Michigan, but there were already 10,000 people that had TB in Michigan, what would be the prevalence number?
10,050.
10,050. So is incidence new cases or old plus new cases?
Incidence is new cases.
New cases.
Prevalence is.
Prevalence is old plus new cases. So the incidence and prevalence questions will be numbers. You either add the numbers or subtract the numbers or just pick a number. When a disease is endemic, does that mean there are a lot of carriers within the population or few carriers within the population?
Few. Well, a lot of carriers.
A lot of carriers.
Few have the disease.
That means large number of population are infected, few have the disease. That means there's a lot of carriers within the population.